Hi everyone, it's Wednesday, time for Wisdom Wednesday. I was out last week again doing a little skiing, which is one of my passions, and took a week off. So we're back in the saddle here, and I did survive, and my only desire with skiing is to live to ski again. So this is great. And so today I thought I would visit an issue that kind of came up with a patient recently about the concern of continuing hormone therapy after the age of 70. Apparently, a study came out of Denmark back in the summertime, and it addressed the concern about menopausal therapy and dementia. And this particular study that came out was not using bioidentical progesterone. They were using Progestins. In fact, they used about 5 or 6 different Progestins, and in each case there seemed to be some negative effects as far as development for dementia. And one of the things that we know about utilizing a bioidentical program of 17-beta estradiol, which is the main estrogen that we utilize for replacement and for optimizing levels in our blood. And of course, we use natural progesterone, and the data with natural progesterone as opposed to all these synthetic progestins is that there's just different types of signaling that occurs within the cell, and how the cell incorporates this particular hormone into the receptor sites, and how those receptor sites then signal cellular health and whether or not they can increase the risk for DNA damage, which obviously we would like to avoid. And that's the difference when we look at the data specifically utilizing these synthetic progestins versus natural progesterone. And that, unfortunately, what appears to happen in the world and how these scientific studies are presented to the public is that they are considered to be equals, and they're just not. There is a huge difference between natural progesterone as a way of optimizing hormones versus utilizing these other types of similar type of hormones, but they are synthetic. And when you look at, for instance, birth control pills, these are all synthetic hormones utilized to suppress ovarian function. But when we reach the age of menopause and utilizing hormone therapy to optimize these levels in our blood, we, in our practice, definitely use just those that are fully recognized by the body. Yes, they must be made and synthesized, if you will, in a lab, but those molecules are exactly like what our body makes. And the concern, obviously, is our meaning and purpose in all of the things that we do with our hormone program is to optimize our health, to optimize our lifespan in addition to that, and to help the body function in the most optimal way that it can. And when we look at what we do from a hormonal program, it's also combined with lifestyle improvements of exercise and optimizing sleep, optimizing our nutrition, trying to optimize our stress levels. But when we do our hormone program, it has really been shown to optimize our ability to function in our world much longer and to sort of stave off any of the specifically aging processes that occur in all of us over time, and to try to slow that process down. And ultimately, we want to compress that illness phase of life to the end of life, so that we don't see this just significant decline from our 50s onward. And so we kind of, rather than see that curve, that decline in health go kind of at a straight level down, we try to sort of keep it at a level and then sort of compress, as I said, that illness phase of life to the end of life. And we know that when we looked even at the WHI study, the Women's Health Initiative back in 2002 that was released and stopped early because of things that they were seeing, and ultimately realized that particular study was utilizing Premarin, which is horse urine estrogens, which have some estradiol in them, but only about 15%, and the rest of the estrogens within that product are often other estrogens, but also foreign estrogens because they were from pregnant mares. And then the progestin used in that study was medroxyprogesterone, which is not natural progesterone. And so we did learn from that the estrogen component alone, even by itself, did not enhance risk for dementia or Alzheimer's, but when the medroxyprogesterone was used, that it did. And the studies are now showing that combination therapy with estradiol and natural progesterone actually helped prevent that, or certainly does not enhance the increased risk for any types of vascular dementias or Alzheimer's, if you will. That natural progesterone does not interfere with the beneficial effects of estradiol. And that's more the case. It's not that it prevents it in and of itself, but it doesn't take away from the benefits of estrogen overall. But progesterone, natural progesterone, has many wonderful qualities, particularly in terms of trying to protect our breasts. It increases what we call the breast cancer resistant proteins that we see that can help protect DNA and keep DNA from being damaged, that increase our risk for abnormal cellular production, such as cancers. It also helps with it helps with testosterone in helping build natural bone. Estrogen is an anti-resorptive, and progesterone, testosterone are builders and help with that. It's also very calming, particularly when we give progesterone at night. Orally, it has an effect of having a nice somnolent effect, so many of my patients find that natural progesterone is very beneficial from the standpoint of aiding in the sleep disorders that occur as we become older and as menopause comes up upon us. It's very beneficial for that. And so it's a nice natural yin to the yang of estrogen. It's a balancing. And so even women who've had their uterus removed, many are told you don't need a progesterone, but we find that the progesterone is quite beneficial for many other aspects of overall health, wellness, and longevity. So I hope that helps a little bit when these studies come out and you find that you're concerned about them. I love it when you bring them to me so that I can review them. And I typically do review a lot of articles all the time and are always looking at the evidence for what it is that we do, so that at all times we are trying to do what is the best thing for our patients for aging well and for being healthy. And so just know that that's a constant thing that we're looking at. And if you find things or hear about articles or read anything, please feel free to bring them to my attention. I always want to learn, and it is in our utmost interest that you are the healthiest that you can be with what we are choosing to help you do with a hormonal program. Hope you all have a great week. I hope that helps for some of you who are concerned or have been told you need to get off of those things. They're terrible. You need to, as soon as you get to a certain age, you should get off, etc. Whatever that may be, please bring that to our attention, and I'm happy to address that for you. We are here just to help educate and to serve you in the best way that we can, and we're always open to learning new things and evaluating all the data that comes out. Hope you all have a great week. Hope this has been helpful, and we will talk again next week.